Hello everyone, welcome back to another episode of Pharmacy for the People, where I try to put your health back into your hands by breaking down complex medical issues into bite-sized morsels. My name is James, I am a licensed practicing pharmacist. Let's get going. I'll be honest with you guys, I have been avoiding this video. It's divisive, controversial, potentially rage-inducing. It's deeply emotional and, frankly, really personal, sometimes painful. But we're nearly a year into this experience, and I think I owe you a video on COVID-19. I have a background in annotating genomes of coronavirus, and I have worked through the pandemic on nursing units. So despite my temptation to stay out of the public space and the fight therein, I think I have a fairly unique perspective on what's been going on, and I might be able to help shed some clarifying light. And it might help to have a face to associate with what's been going on. If you haven't known someone personally that's been affected by it, maybe having a face would be helpful. And in case you're rolling your eyes about another COVID-19 video, I'm going to do my best to avoid statistics and guidelines. This is just about what's really going on. But we'll see where the day takes us. If you're lucky, you might see me have a full-blown meltdown on Pharmacy for the People. Okay, let's get the nitty-gritty objective stuff out of the way so we can jump right into the existential aspect. The virus that's being passed around from person to person is called SARS-CoV-2, which is an abbreviation for Severe Acute Respiratory Syndrome associated with coronavirus 2. Number 2. It's called 2 because it's the second major event with a severe acute respiratory syndrome. The first one was in 2002 in China, and that one was just called SARS-CoV. No 2. This is 2. The disease that SARS-CoV-2 causes is called COVID-19, which is an abbreviation for Coronavirus Disease 2019. It's called 2019 because that's when it started, was in 2019. That's when they first thought that this was going on and they first identified it, 2019. It's not called COVID-19 because it's the 19th coronavirus. Viruses mutate very quickly, and the longer they're allowed to replicate, the more they mutate. It's the natural consequence of copying something a few million or billion times without ever having a spell check. You keep copying it over and over again, eventually you end up with new words and sometimes even a whole new book. When I was working with a group annotating genomes, which is where you study the genetic information of an organism, and you map out which genetic sequence codes for what physical structures of the organism. I went through hundreds and hundreds and hundreds of those things just in the few years that I worked there. So this is not the 19th coronavirus. If you were intent on naming them by each one being its own unique strain, then I don't even know. It would be astronomical. 17 billion and 5. Whatever. So coronavirus itself is made of many parts. At the center of every virus is genetic information that codes for the various parts of the virus. In the case of the coronavirus, it's messenger RNA, or mRNA. That's just the abbreviation. Every virus lives by delivering this genetic information into something and having it replicate that genetic information. Many viruses wrap that vulnerable genetic information in something called a capsid. That's like a shield made out of proteins, and coronavirus does too. It's wrapped very closely around the mRNA coil that's inside of the virus. And then around the capsid is an envelope. The envelope is made out of fatty molecules that act like a protector. It's like an envelope that delivers the genetic information like a letter to a house. And then sticking out of the envelope is a variety of proteins, depending on the virus. So coronaviruses have what are called spike proteins that enable it to interact with cells like it's ringing a doorbell. Let me in, it's basically saying. These spike proteins under an electron microscope is actually what give coronavirus its name. Corona means crown. Like this. Sort of, I guess. I don't know. That doesn't look like a crown to me, but it looked like a crown to somebody. Coronavirus functions like most viruses. Viruses can't live on their own. They don't have the mechanisms necessary to self-replicate like a bacteria does. They rely on some other living host to replicate their information for it. So when they encounter a living cell, they ring the doorbell with those spike proteins. They leave the envelope outside, and they let their capsid and the genetic blueprint go inside the cell. Once in the cell, the capsid breaks down and leaves just the genetic material there. And human cells have subunits inside of them called ribosomes. Ribosomes are the readers of genetic material, and they build proteins based on what that genetic material says. It would be like a dad on Christmas Eve when he has to put together all the Legos and toys for the next morning. You just read the directions and you do what it says. So this process goes on and on until the living cell is so full of replications of the virus that it starts to burst, and these new copies of the virus go to find other new cells, and in the human body, our cells are pretty close. So they start replicating and spreading to cells very rapidly. In the process, it kills that original cell. Depending on where in the body the virus prefers to be, this process on the scale of millions or billions of replications and subsequent cell death can cause real havoc wherever it's focused in the body. Coronaviruses are respiratory viruses. It primarily infects the lungs. If the virus is able to replicate like this unchecked, it can rip those precious lung tissues to shreds, which means respiration, the process of exchanging carbon dioxide for oxygen in our tissues, becomes difficult or almost impossible. And then if you've watched my other videos on vaccines, I've talked about how the immune system's response to an infection can make you feel like crud, with fevers and aches and chills and malaise, fatigue, etc., etc. With COVID-19 specifically, the way that we see it manifest and hurt us is based on these two concepts. The destruction and disruption of infected tissue, and the immune response to the infection. So SARS-CoV-2 gets into your lungs, and depending on your body's response and your susceptibility to it, it can manifest from anything as little as a cough to the complete shutdown of your lungs. You may recover entirely, or you may have so much scar tissue in your lungs afterward that you require oxygen for the foreseeable future. You could just need rest, or you might be on ECMO or a ventilator for weeks. Likewise, depending on factors that aren't well understood at this point, your immune system may either help you win the fight, or it may spiral out of control and cause systemic inflammation throughout your whole body. Blood clots in your whole body put unbearable strain on organs that may or may not already have strain on them. It could cause multi-system organ failure. It's a pretty nasty thing to watch. This phenomenon is what's caused people to believe that some COVID deaths are actually attributable to comorbidities, or diseases that people have already been diagnosed with, or that they already have. In reality, people may live long, happy lives with diseases like diabetes, or chronic obstructive pulmonary disease, or heart failure, asthma, renal impairment, etc. But when something like COVID-19 infects the body, it creates this storm that pushes these organs over the edge into failure and subsequent death. People with comorbidities may be more susceptible to the worst effects of COVID because they're already in a weakened state. But it is the effect of the infection that kills people with comorbidities, just like people without them. Like any other virus, SARS-CoV-2 is spread from person to person through infected body fluids. If it was a gastrointestinal virus, it would be mainly through poop or through vomit. If it is through a respiratory virus, like coronaviruses, it's mainly through lung secretions. As the virus replicates in the lungs, our body starts to shed virus, which means that we start spreading functional virus in our bodily fluids. Like I said, since SARS-CoV-2 is a respiratory virus, it's mainly going to be shed through our respiratory fluids, like our secretions, our droplets, and aerosols. Secretions like phlegm and snot are too heavy in general to move through the air outside of coughing and sneezing. So washing our hands and covering our coughs and our sneezes prevents spread from secretions by themselves. Droplets are very small drops of fluid that are able to travel an average of up to 6 feet with a normal speaking voice away from our body. So if you're infected and you're speaking in a normal voice, your droplets may travel up to 6 feet or beyond, or a little shorter. Naturally, they go a whole lot farther if you're sneezing or coughing. So again, droplets, you got to cover it. So wearing a cloth mask or a procedural mask can contain your own droplets and prevent droplets from other people from reaching your nose and your mouth and getting into your lungs that way. Aerosols are very small drops of fluid that are light enough to travel around a room and just float in the air on their own. Initially, it was thought that aerosols were only produced in certain procedures or certain activities in different settings. But recent research has suggested that infected persons, even just with normal coughing or a speaking voice, can generate aerosols into a room. Only highly filtered masks like N95 masks or respirators are enough to filter out aerosols. Likewise, being in a poorly ventilated room inside, if you have somebody that is infected and they're generating aerosols, those infectious particles will just hang out in the air like an infectious wet blanket, just waiting for somebody to inhale them. This video is not intended to be a defense of the CDC or its recommendations, but if you're curious, that is exactly why they recommend wearing a mask, social distancing at 6 feet, and using high-grade ventilation systems while indoors. Something unique to SARS-CoV-2 is that people that are infected and shedding virus for transmission, infectious in other words, may not show any symptoms at all or show symptoms much later. That's called asymptomatic transmission. That is, you get infected by the virus, it starts replicating in your body, but it hasn't hit you hard enough for you to start feeling it. Making it incredibly difficult to control the spread of virus just by keeping people who feel ill away from other people. Even if you feel perfectly fine, you may be contagious to someone around you who then picks up the virus and they don't feel fine. And things go very differently for them than it does for you. So in summary of the objective portion of what is COVID-19, we have a disease that's caused by a rapidly spreading respiratory virus that has a high rate of hospitalization, death, and disability. But if you're a skeptic, you might be saying to yourself,
wait just a daggone minute. You haven't said anything to sustain your argument that COVID-19 has any hospitalization, death, or disability.
And you'd be right. You're right. Up to this point in the video, I have not provided you with any information that supports the idea that COVID-19 has a high rate of hospitalization, disability, and death. At the beginning of this video, I promised, soft promised, that I was going to avoid statistics. This is the part that I've been avoiding all these months. I'd like to tell you what I've seen. Not from a news source, not from the CDC, not from any government agency, not from any other source except right here. For those of you who have watched my What Do Pharmacists Do video, you may know that clinical pharmacists like myself spend a good portion of their jobs outside of a pharmacy, working on the nursing units with the physicians, therapists, etc., helping to ensure safe and effective treatment strategies for patients. As a result, we get more up-close personal interactions than we would if we were just in a pharmacy. So let me pause right there for a second. If you've been blessed in your life that up to this point you've never been a patient in a hospital where you're so sick or disabled that you're entirely relying on someone else's care, or if you've never had to make difficult medical decisions on the behalf of someone that you love, the word patient might not carry the same weight as it does for somebody else. So what I'd like to do is to try to paint a picture for you. I'm going to do my best here, but it will rely extensively on you picturing what I'm trying to tell you. So if you'll do me the honor of trusting me just a little bit more, I'd like you to try to really imagine what I'm describing. Try to put yourself in these shoes. So imagine getting a phone call from your mom, and she's just calling to tell you that your dad has a bad cough, and he needs to go see somebody about it. It's been bothering him for a while, and it's getting worse. It's nothing serious. She just wants to call and let you know that As part of their plan of the day, your dad is going to get checked out at his regular doctor's office. Then a few hours later, she calls back, sounding pretty shaky, saying that the doctor actually called for an ambulance to come and take your dad from the doctor's office to the emergency room because your dad's cough was so bad that he wasn't able to catch his breath anymore, that he was getting worse. They're going to check him out in the emergency room, and then she's going to call you to let you know how he is. In a few hours, she calls back to say that he's okay, but they're going to admit him on oxygen, and that he's tested positive for COVID-19. She's not allowed to stay with him because they don't want to let it spread to anybody else. So she's going to go home, and your aunt is going to come over and keep her company during that time. The next day, your dad's in the hospital, and then the next day, and then the next day, and another day, and another day. He's still in the hospital. He's not getting better. Now he's on a breathing mask, and they're trying new medications, things that have recently come out, developed specifically for treating COVID-19. They're trying things to see if it's going to help. But he's getting worse. And after a week, your mom calls crying to tell you that they have had to put a tube into your dad's throat because he was not able to maintain his oxygen on his own anymore. The breathing mask didn't work. The medications didn't work. They've got him in a kind of coma to keep him from fighting the breathing machine. And the doctors are telling her that they're going to do everything that they can, but that she needs to start preparing herself for the worst. What would news like that do to your mom? How would it affect her? How would she react to that? How would you react to that? What would that feel like? Can she afford the house that she is living in if your dad isn't there? Will she know where to find things if your dad isn't there to tell her where he's put all the things that dad's put in random places? What if it was reversed? What if it was your mom in that bed struggling to survive and it was your dad that was watching helplessly? What would it do to him? Can you really imagine that? Can you feel that? Nobody wants to imagine that kind of grief. Nobody wants to feel that kind of sorrow. What if a few days after your dad was admitted, your mom and your aunt were admitted too? What if within 1 month you lost your mom, your dad, and your aunt? What if instead of dying, they just went from having really active lifestyles all the time, going out and doing fun things, to being tied to an oxygen tank for all their normal activities? This isn't hypothetical anymore. I've watched these things happen. This year, I've watched this scenario play out far more times than I was emotionally prepared for. Losing a dad, an uncle, and an aunt, one after another. The family crippled from the grief. A fiance watching a fiance get weaker and weaker, week after week, and finally having to say goodbye. Having to make the choice to end his suffering. I mean, he can still lock eyes with you. He will still look at you and respond to your voice, but his body is breaking apart. And you have to make the decision to let him go because he is suffering. Mom and daughter in different rooms, husband and wife in the same room, people stuck in the hospital for months waiting to be able to breathe well enough to go home. To go home to their spouse, to go home to their children, wanting to go home to a dog, or a faithful friend that they haven't seen in months. Children yelling through a glass door about how good a daddy their dad was to them as he passes away. A man in his 80s watching his wife and his best friend of 60 years go on without him, where he can't follow. A mom and 2 small children calling in by tablet to tell their dad in his 30s goodbye because he's not coming home. A lady squeezing a nurse's hand, gasping for breath, praying. The nurse doing her best to comfort her and stroking her hair. This isn't about me or healthcare workers, because we would keep getting up and doing it every day anyway. But we're a part of this too. We put a part of ourselves into each patient that we work on, that we try to support. And to lose one is hard. You know, you see the families come in. You get to know them. You visit with them sometimes as you're in and out of the room. And to lose one is hard. But to lose and lose and lose and lose and lose, and then to leave that and come home and have the people closest to you, your support structure, tell you that it's all fake. It's a political scheme. It's blown out of proportion. To treat the loss of a life, lives that are precious. Maybe they're not precious to you, but they're precious to other people. To treat it with callous disregard dehumanizes the people that we lose and the people who have lost. I have not been in all the hospitals in America or across the world, but I have been in mine. And if what I've seen and experienced here, which I know has been mild by comparison to some, but if that has been amplified all the way across the country, then I don't for a second doubt the estimation of the loss of 600,000 people in America to COVID. These are not numbers. These are people like us with innumerable connections, loved ones, plans for the next day, plans for the next year, like us. So let me tell you what COVID-19 is not. COVID-19 is not a hoax. It is not a political agenda. It is not a means of controlling people. It's not a way for doctors to get paid more. It's not predictable regarding who it will hurt. And it is not on the same par as the flu or a cold. COVID-19 is a disease caused by a rapidly spreading respiratory virus with a high rate of hospitalization, disability, and death. And we're just a group of people trying to respond to it. This has been very cathartic for me to tell you these things. So thank you for letting me bear a part of my soul to you. But as I close today, I'd like to talk about our response. How do you respond to a pandemic? How should we respond to a pandemic, an infection that crosses international lines? The way I see it, there are really only 3 options for response. Consider your family. Look out your windows at your neighbors. Think about the people that you work with. You have to answer for yourself the question, am I okay with hurting, hospitalizing, or potentially killing one of these people? If your answer is no, then you really only have 2 options of response to COVID-19. You can either take responsibility for your actions, take responsibility for your ability to spread COVID-19, or deny that it's happening at all. That's it. Either accept the reality and do something to prevent spreading the disease, to prevent hurting hospitalizing or killing somebody. Or you deny the risk and the need for response entirely. On the other hand, if your answer is yes, I am perfectly comfortable with hurting or killing these people, then you can stop there. That's it. That's your response. You go on with life and do whatever you want to because you don't care. While my worldview constrains me to love my friends and my family and my neighbors, strangers, and even my enemies, it also constrains me from forcing you to make decisions the way that I do. For those of you who answer, no, I don't want to hurt someone, but deny the problem and boldly proclaim that there is not a rapidly spreading respiratory disease, I've made my case that this is our painful reality, as difficult as it is. All I ask is that you provide some substantiated way to show that you are not living in denial. Not to me. You don't owe me anything. You owe it to yourself. You owe it to yourself to prove that you are not living in denial. Make sure that you're actually living the way that you intend to. If you are not okay with hurting people, but you also cannot objectively look and say, yes, people are being hurt, disabled, and killed, make sure that you're not making a mistake and living in a way that is contrary to the way that you want to live and the way that you want to interact with these people. For the rest of us who are not okay with hurting someone, and we're also not able to refute the reality of the virus that we're living with, we're left with taking responsibility for our actions in some way. And I do mean some way. We know that SARS-CoV-2 is a coronavirus. We know that coronavirus is spread mainly through airborne droplets. We know that those droplets typically travel only about 6 feet when speaking in a normal voice. We know that masks worn over the face and the nose capture the droplets from either getting to you or getting to someone else. We also know that washing and sanitizing your hands will remove and kill the virus. There are 3 ways that you can possibly respond and make sure that you don't accidentally hurt, kill, or hospitalize somebody. So why not start there? Why not start with those 3 things? For most of us, that does not represent a significant sacrifice in our lives. And even though I can't dive into the well of controversy that is vaccines right now, I'd be remiss if I didn't at least ask you to consider getting one. Vaccines help prevent our bodies being overrun by virus, and they stop viral replication that makes us contagious to others. In lieu of addressing specific concerns with it, I will add some resources in the description below. Embrace potentially killing someone, deny the problem, or take responsibilities for our actions. I just don't see a way around falling into one of these categories. Now, to be clear, I am not condemning people who are living in denial of a painful situation. I don't condone it, but at the same time, processing through grief sometimes looks like denial. And it's for us to recognize that in ourselves and process our way through it. Move through the denial so that we can arrive at where we want to be, so that we can be in control of our actions and our intentions again. Don't be quick to dismiss the idea that you might be living in denial. There were definitely times this year that I lived in denial. When it first started, I dismissed it wholeheartedly. I thought it would never come to America. And then it did, and then it was in my hospital, and it was terrible. One way to ensure that you're not just satisfying your own preferences and emotions with different forms of denial is to take a hard look at your worldview, your value structure, the way that you interpret moral imperatives, and make sure, do whatever you can do to make sure that you live consistently with that. If you have a list of things that you believe are good and true and right, make sure that you're not adhering to it in one part of your life and completely dismissing it in another. You may learn a lot about yourself in the process. I know I have. I've been very surprised to see how quickly I was willing to dismiss lives in different places of my life. This year has not been a joyride for any of us. I'm sure it's fairly obvious why I've been avoiding this topic. Some of us have been shaken to our cores, our relationships tested, broken, or lost. To any of you out there who have lost someone that you love to COVID, I am so sorry for your loss. And I am confident that you are not alone in your grieving. For everyone else out there that's just taking it day by day, doing the best that you can, please don't give up. Every effort matters and you make a difference. I'm very grateful as a healthcare professional who has been overwhelmed and very distraught at times. It has meant a lot to me personally to see people encouraging other people or taking responsibility themselves. That means a lot to me. Thank you. And it seems, in a stroke of luck, that I've made it all the way to the end of the video without using statistics. Yay for me. But if you are wanting some recommended sources, I'll post some links in the description. Remember to ask your questions and comment below. I'm sorry for bringing in such a heavy topic, but I'm also not. Such are the times that we live in right now. Thank you very much for watching, and I'll see you next time.